Keller funnel is a very, very interesting piece of equipment that we use in the operating room. Here's an example. It looks like a cake decorating funnel, and I think Dr. Keller must have been watching his wife decorate a cake, and he had one of those moments where he went, "Eureka, I think I know a way of getting breast implants in through a small opening." We call that a puka in Hawaii. Getting it through a small puka, a big implant in through a small incision. At any rate, the Keller funnel is truly one of the more brilliant things that's come out in a long time in plastic surgery. The Keller funnel gets a big implant into a small incision, and that way you have what's called the no-touch technique. The key to decreasing the chance of capsular contracture is to avoid two things in surgery. Obviously do and eat surgery, but one, avoid blood around the implant, and to that extent we lavage the area, and we also put a drain in to get that last little bit of bleeding out. Number two, we don't want to touch the implant because, and I'll explain this term, non-pathogenic bacteria get into the body, they get in around the implant, and then they later cause a capsular contracture. The key to the Keller funnel is you can drop the implant from a sterile plastic container. That's how that comes from the two American companies. From that sterile plastic container, you can dump the implant into the Keller funnel. Then from the Keller funnel, you put it inside the opening, the incision in the armpit, and you're able to get the implant into the pocket without ever touching it. So to decrease the chance in surgery of getting a hard breast, I certainly, and probably most of the plastic surgeons in the United States, certainly recommend using the Keller funnel intraoperatively so as to get the implant in using what is now referred to as the no-touch technique.